Hi, Jessie.
Hi, how are you? Happy Sunday.
I'm doing, yeah, I'm so glad you're back. Yay.
Thank you.
Yeah, a lot of people wanted you to come back, just so you know. They were like, oh, that was really good. Can we have her back again? Like,
Excellent.
yes.
I'm happy to come back. I'm happy to come back again. It's fun. Nice to chat with
Awesome.
you on a Sunday.
Yeah, yeah. So, yeah, I think a lot of people here in the group already know you, that you're a pediatrician by trade, but you have all these other exciting, amazing ventures in wellness. And so that's what we're going to explore some more today. And again, if you would be kind enough to maybe do a little grounding practice for us, and then we can maybe get started with some of the other wonderful things that you're doing.
Excellent. I'm happy to. And as you said that, I am just going to ground myself, and hopefully all of you can take a moment to do that. Just find a comfortable seat and notice that perhaps you didn't take a comfortable seat the first time you sat down. And feel your feet on the floor and your hips grounding into the earth or the seat below you. Just take a moment and grow your spine out of your pelvis, reaching up towards the sky. Drop your shoulders down from your ears. And place your hands on your thighs or in your lap. Take a moment to deepen your breath in through your nose and out through your nose. Take a moment here to pause and be present. Notice the change that happens just from the stillness. Pause and presence is a gift for you and a gift for those around you. Notice what happens when you pause. Notice what happens when you're present. Pausing allows you to step back, see the bigger picture, breathe, and find spaciousness. In the spaciousness, you can get to know yourself a little bit better. You can find peace by accepting and allowing things as they are. Being present allows you to experience the here and the now. Notice and enjoy the here instead of always thinking about the there. And even here, with whatever the sounds in the background might be, just notice where you are. Notice the calm and the stillness within. Notice your chest rise and fall, and rise once again and fall. Bring your left hand to your heart and your right hand to your belly. Take a notice of your heart beating underneath your hand and your chest rising and falling. Just allow yourself a few more breaths here of stillness and presence. Notice the change in your body right here, just since a few moments ago. Connect with the difference in your nervous system, and the difference in your heartbeat. Realize that this pause and being present is available to you whenever you choose. Slowly bring your hands back to your thighs and open your eyes slowly. Let the light back in. Just a soft gaze. No judgment about anything around you. And once again, just notice how you feel. Notice if you feel much more centered and grounded and different. And with that, I think we'll start our conversation.
Totally got Zoom bombed here. Yeah, my son's here on the weekend, and he just went to have lunch with his friends, and he has no clue like what's going on. And then my husband's like, Avi, sorry guys, but this is real life.
Well, you know, what's interesting is I actually thought, although it makes it much harder, you know, you notice your heart rate going up with all the stress and then coming back down with the silence. Yes. And like trying to breathe through it and trying to remain steady through it. And I think that's actually really helpful, right? Because you can do that. That happens to us all the time, right? Someone cuts you off, or a patient is late, or, you know, something, whatever, something you weren't expecting. So mindfulness doesn't have to be that perfect meditation. That's what I was going to throw out there, right? Like, we all have lives going on around us. And so we might be trying to be calm and mindful. And I live with teenagers and they show up, right? And so it's a chance to sort of see and notice how the pause and presence changes your physiology, and then how something else changes it. And that shows you how powerful it is, right? And how quickly you could get back afterwards and just really recenter. So it's a perfect experiment.
Yeah. Yeah, it's interesting, Jessie. I don't know if I've mentioned this to you before, but I actually I'm a certified meditation instructor. I did a 9-week course online with Susan Piver, and it's called, it's the Shambhala methodology, if you will. And it is very much the Vipassana. And it's an open eye meditation. So open eye meaning, gaze down, but still open eye. And obviously one of the questions that came up was, what's the difference? And so her response was, we don't go, and there's different kinds of meditation, right? And you try to find one that works for you. But her response was, we don't go around our life with eyes closed, and, we're aware of everything that's going on. And so there's not this sudden, like you snap a finger and you're in meditation, snap a finger, you're out. You're still learning how to be present in the moment with all the chaos that's going on around you. And I think as clinicians, that is such a useful tool to develop.
Yeah, absolutely. Absolutely. So it was perfect, right? As we say in coaching, it was perfect because that's how it happened. So.
I like that. So Jessie, I wanted to delve a little bit more in this session about yoga. I know you're a yoga practitioner and a teacher, and I was just wondering if you could fill us in about how that interest developed, and what it's done for you personally, and how you're incorporating it to help other people around you.
Happy to. I love yoga, and I love talking about yoga. And so, interestingly, I was thinking about this the other day. And my journey with yoga started actually as a medical student a long time ago. So I was a medical student in 1993, I think was my first year. And I took a class. So I went to UCSF, and we have a lot of hippies in San Francisco. And I took sort of a yoga class in the evening. It was 8 weeks. And the first 2 or 3 weeks, this teacher, her name is Barbara. She's actually infamous in San Francisco, but I didn't know it at the time. And she focused on your toes and being able to open and close your toes like this. And I thought, like, is this really yoga? What's happening? Just these, I loved it. I mean, we also learned some other yoga by the end. But then, so I did my 8-week course, and I did a little bit of yoga. And then I had a baby in medical school and a baby in residency. And I was in residency and became a doctor. And I kind of didn't do much yoga. I would go here or there to a class. And I grew up in Berkeley with a lot. My mom I shouldn't call them hippies. Hopefully they won't listen. But we did have a VW bus in the 70s and goats in the back. So maybe they really would be okay with it. But my mom used to send me stuff about Jon Kabat-Zinn. One of my babies didn't end up being super premature, but I went into labor at 24 weeks and I was on bed rest. And so my mom started sending me Jon Kabat-Zinn things to listen to. And so, I've had a little bit of in my life, but I didn't grow up with it necessarily. And then, it was a few years ago that I came back to yoga just during a really difficult time I mentioned this last time, but it was a difficult time where I had a number of leadership jobs, a full-time practice, 3 teenagers, and my husband had some mental health issues. And I just was like, this is all too much. So I went back to yoga. And I showed up one day and you just started breathing. And it was like one breath at a time. I just started to feel better. And the yoga made such a difference that I literally started doing yoga almost every day from that point forward. And I wasn't in good shape. I had actually gotten to a place where I was kind of out of shape and working all the time. And I weighed like 40 pounds more than I do now. And, but just the breathing made such a difference. And then the movement, and then the presence. And it sort of gave me the tools to move forward. Mm. What I love about yoga is, it's not, as we say, it's not just standing on your head. It's actually a philosophy of life. Mm. And the philosophy of, that's actually where I get this like pause and presence from. That it's just about being in the moment and where you are. And even when there may be all these things outside you that are out of your control, whether it's noisy teenagers or COVID or, lots of other things, it's a chance to just sort of be and feel safe. And it's physiologically safe too, right? I think that's where the breathing, it's like the parasympathetic nervous system kicking into gear. And so I went to this it's literally my neighborhood yoga studio. And I immediately bought the unlimited pass and I just kept going. And I wasn't going to the fancy hard classes, and I don't stand on my head. I actually have a number of like chronic injuries. I've had a crazy medical past actually you wouldn't know it looking at me, but I have. And, but I did what I could, and I loved it so much that literally within the year they had a teacher training. And I said, I'm going to be a yoga teacher. I want to understand it. And I want to really, as a physician, wanted to understand why it was working and what it was doing, right? I was also inspired to do the teacher training because I think, as I mentioned last time, in this transformation process of doing yoga, I'd also hired a coach. And in doing the coaching, I was learning more about myself and what I wanted to learn in the world and be in the world. And so part of that inspired me, because I would have said, at 48 that I was not going to become a yoga teacher when I had never, not done it before. And instead I was like, sign me up. And I was by far the oldest person in the teacher training, and it was fantastic. So I then did that training, and I really learned more about the yoga philosophy, which is what really resonates with me. And I didn't even sign up thinking I was necessarily going to become a teacher, but by the end I thought I can share this, and I share it even, as part of my practice. I would talk to kids about yoga. I would talk to kids about the meditation portion of it. I did a second teacher training on teaching kids yoga because I'm a pediatrician. And I will tell you, actually, to be totally honest, I haven't yet taught kids yoga classes, although I had in my mind I would do mom and me and all that stuff, but I haven't done it. But what I loved about that was this idea that yoga doesn't have to be serious, and it doesn't have to be all the things. It's really just about being present and learning about yourself and exploring. And the kids yoga is about fun, right? And so that really allowed me to bring that playful piece into it. And one thing I learned there, which I just have to say as a pediatrician, is that they taught us that the best thing that parents for kids under 8 can do is learn to meditate. And so I actually use that in my practice all the time. And this idea that, I have a lot of 2-month-old, 4-month-old parents who are like, what can I do to stimulate their development? And now I say, you can learn to meditate, and it will serve you well when they're teenagers. It will serve you well. And so I think it just added to my practice so much. It added to my life so much. And it really changed. There's just so many philosophic parallels between yoga and being a doctor and being a coach, right? It's really about taking ownership of your life, and health, I would add into that, right? It's taking complete ownership of how you show up. And so some of the yoga philosophies, like what you do with your body impacts your mind, what you do with your mind impacts your body. And so those are the kinds of things, even as a pediatrician, that kids and adults can learn that just dramatically changes things. And so
how was it received by your patients? Because I'm kind of trying to think about how that would have been. Olympia is a fairly liberal town, but when people come to an internist or a pediatrician,
I will tell you, actually, it was received great. But I would tell them, my patients knew I had become a yoga teacher. And at this same time period, so I had worked with a coach, I had become a yoga teacher. I had noticeably lost 40 pounds. And so a lot of people said to me, like, what are you doing? You look great. And I was just so much more relaxed and present with them. And so they would often ask me, and I would say, oh, well, I'm doing this and I'm doing this. And so I think it was received better from that standpoint. But I've also always been kind of a very open book. And I think that as a parent, like I can say that, I talk about things like that and people didn't seem surprised. Not all the 2-month-old parents were super receptive. They're like, no, but I actually just want you to tell me what to do. And I'm like, that is really the thing. Like, I'm speaking from the heart. And I think now that, people are getting even more and more and more accepting of it.
Yeah.
So, and I have had teenagers who I teach mindfulness. Those I refer to like Headspace or Calm, because I feel like they like the phone and no one knows when they have the earphones in. And so they are more receptive about that. Though some will say that they go to yoga. So I have my son will be 24 tomorrow, my oldest, and he actually saw what the yoga teacher training did for me, and he signed up and did it a year later. And we've actually did co-teaching classes now, which are really awesome, like intergenerational yoga. And he actually tells everyone, well, I did it because I watched my mom do it, and she changed her whole life after doing it, and like I wanted to do that too. And he's not he's a crunchy granola, outdoorsy, like Peace Corps type. He was actually supposed to be in the Peace Corps right now. That's why I can say that, except he's not because it was canceled. But, and so I just think it actually does resonate with the younger crowd.
Definitely. Yeah. Can you talk a little bit, you mentioned like the science of yoga, because you have the lens of a physician, and there's definitely, especially that there was a, Kaiser sponsored study which showed improvement in chronic low back pain with yoga. So there's definitely some studies around that. What is your sort of, your take on the intersection of yoga, like in modern medicine? And we know the physiology, but is there anything more that you can add?
To me, it's mostly physiology. Though what I actually think is when we become more calm and more present, we're just more intentional with all of our decisions. And so I think that people can make much healthier decisions, and that's the impact that it has. There was a more recent study done out of Boston that actually looked at teaching yoga in all different specialties. So it included ER, oncology, and a lot of the work's been done in oncology and with pain. And it actually looked at, it was something like 40% of healthcare costs decrease over,
wow.
It was a 5-year study. It was not a randomized controlled trial at all. And I actually have a friend who did the yoga teacher training at the same place, and she is a forensic psychiatrist. And she was telling me, because I was asking her about the research, that in other countries, there's tremendously more research. And in the United States, we don't have that much. There's a book, though, by Timothy McCall. I don't know if you know of it. It's called Yoga as Medicine. And he actually lists every research study done up until the time of he's a physician. He's an ER doc who actually has now become just a yoga person, and that's all he does. And he wrote this book that has chapters on yoga and depression, and yoga and anxiety, and yoga and thyroid problems, and yoga and pain, and all the things. And it's quite a novel, but it's fascinating.
So it's yoga in medicine or yoga
as medicine?
As medicine, yoga as medicine. Let me see if I can put that in.
He has also a website.
Okay.
And so I was telling you that I gave a CME last year on yoga as medicine for patients, physicians, and I also think for the healthcare system, right? Because it's all interwoven. And I used his book as a reference there as well. And that's where that study, where the significant decrease in healthcare costs was part of my research for that talk. And so I think there is research out there, but there are not the true kind of randomized controlled trials yet. It's becoming more common. What I would like to see is that it just becomes something that people do. And again, it doesn't have to be standing on your head. Like yoga can be super simple. It can be doing 5 minutes of yoga or a pose. So I think that a lot of people feel like it's too hard. and I'm going to throw my husband under the bus, but he won't listen to this either, so it's okay. He said to me, so he has started doing some yoga. He's not a yoga person at all. In fact, he's super inflexible. And he said to me at one point, like, if people knew how easy it was, they would do it. And he's like, you guys are not selling this properly. Like, and so I think about that a lot now. And so I feel like one of my passions is to share how accessible yoga can be and how transformative it can be. Because
I mean, you can even do things like chair yoga for senior citizens.
Absolutely. Yeah, absolutely. Mm-hmm. We did actually in the Mindful Healthcare Collective, I did a session earlier where we were talking about COVID anxiety, and we did 20 minutes of chair yoga in this exact seat. It was kind of like, we just did arm stuff, and you can do like seated cat-cows. There's lots of amazing stuff. So it's accessible to everyone. There's yoga for, elderly, there's yoga for babies. Anyone can do it. And in so many other cultures, it's an integral part of life. And
totally.
An integral part of health. That's actually, to me, the most critical thing.
Right. Yeah. I mean, I find it really ironical that, grew up in India, and I mean, yoga originated in India, and I've done yoga off and on, but, and actually this last time when I was in India, I was seriously considering doing yoga teacher training just because I was already there, but the timing of it just didn't work out, but that is definitely on my bucket list.
You should totally do it. I actually tell people, do it whether or not you want to become a teacher, because the learning of why and how and understanding, it's fun as a doctor because you know all the muscles already. You just didn't learn it in this way. And so for me, it actually helped me understand anatomy and helped me understand why certain things work and don't work. And so I thought it was super enlightening. The other piece about yoga that I think is so important is the idea of like compassion and caring for yourself. And it allows, so as physicians, we're really hard on ourselves. And actually, I'll say most of society is pretty hard on themselves. And it really does come from this place of like self-acceptance. And it's a practice. It's not a perfect. And so it's all of that is so important for people. And I think listening to that and just hearing it like over and over and over and over again, you can't but shift your whole mindset. And so,
right. It almost sounds like this is what popped into my head when you said that. And it's like, how you do yoga is how you do life.
Yes. Actually, in that talk, I talk about it. Yoga is a way of life, right? It's about balance, and it's like challenge yourself where you need it, but soften where you can't. It's about interconnectedness, right? Like breathing and posture and your nervous system. It's about all that. It's about community. Right. Yoga is life. It can be. And that sounds a little hippy dippy, but I think if you treat it that way, then it's easy, right? It's not like, I feel very strongly it's not like just going to yoga class. And that's actually how I teach, right? I bring like, to me, it's like mindset, and I call it coaching mantra into my yoga, but it's really about self-nourishment and healing and strengthening yourself so that when you leave the class, you're a stronger, healthier person, not from like a weightlifting standpoint, but from a holistic health standpoint.
Right. I mean, yoga goes beyond just the asanas, right? Like, I mean, that's the focus in the Western culture is you go there and do your 20 poses or whatever. But, and the other thing about yoga in particular, well, for one thing, you have to be really tuned into your body. It's kind of hard to almost not be present when you're doing, especially if you're doing balance poses and stuff, like your mind really cannot be anywhere else, or you're going to just topple right over. So it's almost like a forced presence, if you will. And the other thing is just accepting that every day your body's different. One day you can touch your toes and the next day you're like, what the heck happened? And, clearly what I've noticed is like the unevenness of our bodies, right? Like, I mean, my right, I call it my weak side, but really it's a different set of muscles, and it's very much an embodied practice. Like your mind really cannot be anywhere else but focused on what you're doing. And that's a great practice for bringing kind of off the cushion into your general life as well. Like you do everything with that same kind of presence. And that's what leads ultimately to how you can have that sort of, balanced way of looking at everything. Some days are crappy in clinics and some days are great. And you take it all with the same equanimity, I guess.
I love that word. Yeah, it's definitely a yoga word. And I think it's why it helps with health, right? Because then you approach your eating that way and you all of a sudden notice that, like, I feel really awful after I eat this thing, and this thing, I feel great. And so it really just changes, it allows you to notice things. For me also, I like to be really honest. Before yoga allows me to pause and be present, and I have trouble just otherwise stopping and meditating just off the cuff. And so having something defined or having someone to guide the class and listen helps me stay in that moment. And I really needed that at the beginning. So I know that for some people, they really need a guide, and you just get into your own head otherwise, and you don't know where you're going. And so for me, yoga was the answer to that. Well, yoga, and then I'll say coaching is also a guide, right?
I was going to say that's a great segue to coaching when you're talking about us being in our own head and kind of getting in the way. So was there anything more you wanted to say about yoga? Because I definitely want to hear a lot more about the coaching piece too.
I think they'll come up together, because I have to say what's really interesting is I didn't realize it when I was doing them. And I actually did the training separately. But in my mind, they've actually really morphed, and so much of what I learned about yoga, I use in my coaching. So the kind of coaching that I do is mindful coaching. But so much of coaching is, when you're talking about intentionally responding, same type of thing, right? You're right back to intention. And you have to pause, when you're trying to help people, you have to look inside and see what's going on. And if you aren't aware about what your thoughts are in your brain, right? You can't change them. So again, it's back to the presence and pausing and being present to know what's there. And so a lot of people think of coaching as someone telling you what to do, but at least the way that I was trained in coaching, and there are coaches like that, right? Sports coaches kind of tell you what to do. But the type of coaching that I do is really looking at what are you thinking and how it's impacting your life. And so you have to stop and figure out what you're thinking. So we all pretty much operate on autopilot for much of the day. And what coaching is interrupting that autopilot and making conscious decisions and showing up consciously. And when you do that, everything shifts, but it's shifting from a more authentic place. And that's how I like to approach it. And so what's interesting to me is, although you're not starting out like, I want this goal or I want that goal, you end up with these crazy, amazing results that you weren't necessarily expecting, and yet they're clearly the right ones for you. And so it's more of an exploration. And I guess yoga is an exploration too. I'm just going to throw that out there, right? They're both explorations which lead to amazing results in a different life. I guess that's what I would.
That's a great, I kind of didn't really make that connection till you put it like that. Can you maybe, for people who might not be very familiar with coaching, maybe kind of give us some examples of like how the process works and like who could be helped by it and that sort of thing?
So coaching is a process. So it's not like, it's definitely something you don't just do one session and you're done. Although a lot of doctors are really hopeful that they could just do one thing and be fixed. And it's a process of fixing yourself and healing yourself. And so people come to coaching. Many people feel stuck, overwhelmed, frustrated, out of control. Drowning is a word that's used by a lot of my clients. And they very often come because they want a circumstance to change. They want someone else to change, or they want the medical system to change, or they want a colleague to change, or they think that all of their dissatisfaction is coming from the world around them. But they've been trying and trying and trying to fix it, and it hasn't worked. And so I do a lot of career transition and relationship coaching and parent coaching. And what I've discovered, of course, is they all overlap. So people will come for one problem, but it turns out that it's all tied together. And it's mostly tied to this idea that you want things outside of you to change for you to feel better. And so what coaching is changing yourself so that you take ownership for how you're showing up. And then you can feel better no matter what's happening around you. And from there, you make the choices and the changes that you want. So if you think about like weight loss coaching, which is not my area of expertise, but how a lot of people come into coaching, it's actually much of what our thoughts that lead us to overeat, and it's our thoughts which cause our emotions, which lead us to overeat, right? And so I come at coaching with this idea that it's really how you want to feel in life, and it's how you're feeling now that's causing the results that you're having. And so I really like to look at what's causing that. So people come mostly, I don't know how many people were at the Entre MD session yesterday, but I know a lot of people here probably were. And she was talking about the pain point. So people come to coaching because they're in pain.
Yes.
Really, right? And so different things. So it may be that they are feeling stuck at work and they're just not satisfied and they don't know why. For a lot of physicians, right, they've checked all the boxes. And this was what happened to me, right? I went to an Ivy League school, I did medical school, I did residency, I was a chief resident, I had all the children, and I was like, and this still, for whatever reason, like I keep taking on the next leadership role to make it right. Or I keep thinking that, if I could get this to change, I would feel content. And it turns out that's all internal work. And so same thing, when my husband was sick, I thought, well, if I fix him, everything will be better. But that was not my job to fix. That was his job to fix. And so when I fixed myself with yoga and coaching, then everything got better. Mm-hmm. And the things around you do actually shift, especially if they're people, because when you come at it differently, instead of that pressure, I have to fix things, everything in life just changes. Yeah. And so I think people come to coaching for different reasons. Some people, it's usually pain, dissatisfaction. I really think it's primarily frustration, overwhelm, stuckness. People are often, they don't even know why. They're just kind of spinning, and a lot of people are like, well, should I get a divorce? Shall I quit my job? Shall I move? What can I do externally to fix it? And I feel it's so important to do that internal work, and then you can fix the external, because then it becomes clear, like, is it really the job, or is it really your marriage, or maybe it's something else, right? Mm-hmm. You need to figure out, and you can make whatever decision you want at the end, but you want to be really clear about how you're contributing to all of those things, because otherwise, I have a lot of clients that have gone from one job to the next job to the next job, and no job is right. Mm-hmm. And each time it's like, well, this one wasn't right because of that, and this one wasn't right because of that, and it's like you don't want to just go to the next job because it still also won't be right until you figure out what your brain is doing to make everything not right. And then you can truly say, like, well, this job is fine, and this is what I really want to do. Mm-hmm. So with my transition, actually, that's sort of what happened. My job was actually probably a fantastic job, it wasn't that I had negative feelings. I just knew that I really had another passion and another difference that I wanted to make. But when I got to the point of shifting, I was very clear that I was doing it from a place of a passion and a change in the world that I wanted to make, and not because I had too many patients or too many charts, or I couldn't convince so-and-so to change X, right? Right. And that's really the beauty of coaching. And the same thing happens in a marriage or in parenting. Like, we often think, well, if my kid would just stop having tantrums, everything would be fine. Right. But as we know, they don't, right? So coaching and mindfulness are actually really similar in that we use a lot of the words like, of course they did that, right? Mm-hmm. Of course that happened. Of course there's more COVID cases. Instead of fighting reality all the time, you just accept reality as it is. And then with intention, choose what you want to do.
Right. What you're saying, it's kind of like echoes from the past. I'm definitely, it's totally resonating with me. But I think also, it's almost like so many of us got to the brink, to the edge of it, that now I can do it. I can very quickly say, this is the thought I'm choosing about this particular circumstance. But I can't see that I could have done that 10 years or 15 years ago when I was in the midst of my unhappiness. So as a coach, how do you take, if they can't even, like, it's like there has to be a certain level of belief in that, right? Like, if you, as Jessie, come to me and say, Yashada, we're going to talk about this. And I'm just going to keep saying, I'm sorry, I can't be happy because the system's making me do this. The system's driving me crazy. Right? How do you, as a coach, break through that barrier, if you will?
Well, so this goes back to mindfulness, actually, for me, because part of it is just noticing, like, beginning to notice the anger, right? And you notice the frustration, and you have to start by noticing that and pausing before you react, right? And so it's that space between the stimulus and your response. And people who are really upset and can't breathe and can't see and can't think, right? Because they don't even, you can't get them to figure out what thought's causing the problem because they don't even know that
there's
they're
a flooding that happens, right? There's the flooding that happens with all this
they
stress
are not
hormones.
aware that they're having a thought at all, right? They just know the emotion. And so I start with connecting with the emotion. And I actually do most of my coaching from I call it, where I was trained, it's the feeling line and the emotion, because so much of our actions come from that, but so much of our dreams come from that. And nobody misses that chest pressure, right? They just know that. That's why they come to you, right? They can't breathe and they don't know what to do. And they're so frustrated with their husband or their kid or their job or all of the above, and COVID and the lack of masks and all the things, right?
Right.
So I really start with, it's the beginning of just noticing, notice the anger. And then you can begin to think about, well, what's the thought that's making you feel so angry? Why are you angry? And when people can begin to pause, you actually just let them sit and write down everything they're angry about, all the things, right? And so we call that a thought download, where you just dump it all out. And oftentimes you don't even know all the things that are in your head and what are you dumping out. And we ask people to do it without judgment. So again, you're back in the mindfulness, right? Just dump out all the thoughts, every single one, without judgment, and see what you find. And then you can see, right, the thought is causing you to be angry. I'm going to make a really simple model. And now you're angry, and how are you showing up with anger? And most people will say, well, I'm judging other people, or I'm yelling at my kids, or I'm doing X. And then you can look and see that thought, and that's leading to usually a result that's similar to the thought, right? So if you think someone else is behaving badly, usually is the story, right? Someone's being unfair and treating you badly, or they should be doing something different. And you feel angry, and then you show up yelling and judgmental, right? And then you should be doing something different, right? And the whole thing is just a big spiral. And people can start to see that. But initially, it's just creating that space. And so it's the same space you find in mindfulness. It's the same space to see what's happening. And so that's the first step of coaching, because in that first session, so many people are just, they can't separate from the story. And coaching is about changing your stories and being the author of your story, is what I like to say. But until you realize you're the author of your current story, you can't change it.
Right.
Part of it is accepting that. And then you get to really work on, we call it, in the type of coaching I do, the intentional model, which is how you want it to be. And I will say, for so many people, right, they want to skip right ahead to the intentional model. Okay, fine, I'm causing the problem, tell me what to do. It's not a process, right? It's a process. And the other thing I wanted to mention is it's a practice, right? You don't get it right the first time. You don't get it right the second time. You just start by noticing, you're oh, here I go again. And a lot of self-compassion, right? And even, I've been doing at this coaching thing for several years, and I'll be oh, shoot, that's my brain doing its old habits again. And of course this is happening, and you just have to have that, you develop this kind of softness with yourself. I also find people a few sessions in, they'll have a honeymoon period where everything's great, and they're oh, this is perfect. And then they're stuck. They shift back. And it's a practice, right? When you learn to walk, you don't just stand up and walk. You walk and you fall down, and you stand up again, and you walk and you fall down. And coaching is like that, because it's about neuroplasticity, as is mindfulness and yoga, right? You're retraining your brain. And our brains as physicians, but as people in general, right? They're just well trained to whatever age we got to. And so you're interrupting those patterns, which may have served you, for physicians in particular. A lot of these patterns served us really well. They got us through school, they got us through residency, they allow us to do these, crazy schedules, but they don't allow us to have a healthy and healed life. And so that's where so many physicians are coming to burnout.
Yeah.
For me, coaching interrupts that. And whether it's burnout can look like getting divorced, moving, changing your job, yelling at everybody. I have a lot of clients who come because they're angry all the time, and they're yelling at people they love, and they don't even understand why.
Yeah.
And so it can look very different.
Mm-hmm.
As long as you see, most people just come and say, like, I just need something. Can this help? And that's
Mm-hmm.
really, and coaching can't help with everything, right? If you have a
Mm-hmm.
psychiatric diagnosis, I'm not going to
Right.
be like, oh yeah, let's just do some coaching.
Right.
But I think it can help in tandem, if you're doing other interventions too. You really have to want to do it, and you have to want to be part of the change. So if you
Mm-hmm.
are just like, no, I still really want all these other things to be the problem, it's not going to work as well, right? You have to be willing to do that. In the beginning, you might just say like, well, I'm going to try it. Not everyone's all in at the beginning.
Mm-hmm.
And then they have a revelation, and it's like,
Mm-hmm.
oh, like a whole new world is possible. And the idea of coaching is for you. It's not like to fix you for other people. It's to fix you. I shouldn't even say fix, but it's to change you for you. It's to make you better. And when you feel better, it does happen to be better for everyone else around you, but you feel better. And so why not change those thoughts that aren't serving you to ones that do serve you, right?
Yeah. I mean, and that's what it impresses me about that, because, I'm listening to a ton of podcasts, and I'm enrolled in a coaching program as well. And I was, out with a friend walking, and she was talking about, I don't know what it was, whatever the issue is that's going on right now. And, and I said, and so she was like, catastrophizing. Oh my God, our country is, yeah. And I said, okay, so that's a thought we can have, but we can also choose to believe that good might come out of this. Like I don't know what's going to happen in the future. You don't know what's going to happen in the future. But when you have a choice between a thought that's causing you anxiety and pain and stress and whatnot, and you have a thought that's making you feel calm. And I said, it's not escapism. It's not being, Pollyanna-ish. It's not saying I'm not standing up for what I believe is right, but you're coming at it from a different energy, which is more sustainable and healthy, and it's not causing like all that craziness in your head. So, and when you look at people like, Mahatma Gandhi or Martin Luther King or, Nelson Mandela, like all these people who really did change society, it was a sustainable thing, mainly because they came from a space of not so much of anger and anxiety and stress and hatred, but more, kind of stepping back and looking at how can I bring about the change. You know what I mean? It came from a much higher vibrational level almost. And so I think, again, it comes back to yoga and mindfulness and
that's
maybe,
why I think coaching is such an important thing for physicians in general, but for everyone. Like when we heal ourselves and when we show up whole, we can advocate for the change around us that's needed in the world. And when we come at it from a place of so many, and I say this with love because I'm a physician too, right? We often come at it from like the victim perspective of, I've had to do all these things. And so this idea that, if you take ownership of it, you can be the change you want to see. We say that a lot in coaching, which might sound kitschy. And I don't think it's Pollyanna. I tell people that a lot. There is a little bit of what I call mental gymnastics, but it's mental gymnastics to heal you, right? And it's like, well, why not choose something that works for you? Mm-hmm. So it's intentional mental gymnastics. And it's not just saying, oh yeah, everything is great. It's choosing not to fight reality.
Yeah.
I did want to say one thing, because you mentioned when you were walking with your friend, this idea, and it comes up a lot, that we often, when we learn about coaching, want to coach all the people around us and tell them to change, right? And many people want to coach their children too, and they ask about it, like, oh, can I coach them too? And the idea is people have to want coaching and to want to be coached. And so I do think it's important that, if as a coach, people come to you because they want coaching. But in the world, often if you show up to someone and say, you should just think about this differently, it doesn't necessarily go over so well. Right. But what I found is people came to me and said, and I used to be quite nice too, but what happened to you? And like, why you've completely changed? And how did you completely change? And what did you do? And it was kind of like, it reminded me of that When Harry Met Sally part, where they're like, I want whatever she's having. I had all these people come and ask me that, like, what is it that you've done? And it's it's really just making an intentional choice about how you want to live your life and realizing you're going to live this life no matter what, presumably, right? You might as well live one that feels good and is well lived, and rather than spending all your time with the shoulds, right? I mean, I have 3 teenagers. They should do this differently. They should do that differently. My husband should do things differently. My patients should do things differently, but that gets me nowhere. Right? Except unhappy. And so you can really flip that to sort of say like, well, of course they did it that way because they're a teenager. Doesn't mean that you don't act with intention. Clearly they need me to educate them about that not being safe or, you know, but again, I'm not trying to change them. You come at it from a place of love and compassion. Yeah. You also realize that I'm very clear that I'm not perfect and they're not perfect and nobody's perfect, right?
Nobody is,
this comes from a different space than like
she actually took it really well. I mean, we're pretty close friends, and I was telling her about the whole coaching thing, and you know, I was really framing it more as how I approach things in life rather than you should. And she was kind of curious, I could see, and she was like, like I hadn't considered, or you know, it kind of didn't cross my mind that we do have some control over our thoughts. And I'm very cautious because I've sort of stepped into that with like lifestyle medicine, and I'm just running around telling everybody how plant-based is great, and then I just see these barriers go up, you know. So
planting the seed is brilliant, right? Because until they've heard of it, they won't even consider it. And for me, like for kids, I think that's the difference, right? You just model how you're thinking about it and model like, and those kinds of things. And you tell other people, hey, I discovered this thing and this is what I learned. And then they start to think about it. And that's when they come and say, well, I think maybe coaching could help me. And then they're ready, right? And so you have to tell, like if you don't share, people don't know they don't know. Right. So.
You had mentioned at one of our previous conversations that you've had some work with students, right? With medical students, is that at Stanford?
I'm so excited about this. Yeah.
Tell us a little bit more about that.
And I just found out this week that it's going to be even bigger and better. So I'm super excited.
Awesome.
So it's with fellows actually at Stanford. And so I had coached an attending there who asked me if I could work with some of the trainees and if I would do, you know, discounted coaching. And I said, sure, because they really need it. And the idea was that they would come to me one-on-one. And I said, well, that's great, but I still don't know, you know, if they can afford anything, right? And so I proposed that they offer group coaching that the program paid for. And the programs took me up on it because of COVID, right? And this was all because of the chaos, so silver linings of things like that.
Right.
And so the program actually paid for me to provide coaching twice weekly for a month and then once weekly for a month. And now they've extended it for another month. And then they're actually going to make it part of the curriculum for the next year of fellows. So we've tweaked it a bit because what I've discovered is that actually they do need one-on-one coaching because they're still trainees and they feel kind of vulnerable. And a lot of the stuff that they're bringing up is really intense. You know, maybe they had a bad outcome, or if they've had a mental health struggle themselves, or, you know, really difficult patient interaction. As physicians, we don't have a culture of talking about that yet. Right. And so I've been able to do one-on-ones because, as it turns out, only a few people show each time because it's not mandatory. So it's been perfect, actually. And so, but what I discovered from that is the ones where one person showed up were the most powerful intervention and like life-changing. And so I worked with their admin person and I just, you know, explained like this, we really need to offer this part too. And so we're going to offer a combination with the idea that if they've done a couple of sessions on their own, that then you can do groups. And I actually think from the coaching model itself, that that's a beautiful way to do it anyway, because you can address your individual issue. We learn so much from watching other people get coached too, though. We often don't even realize that we were thinking something similar. So there is tremendous power in that. And there's a way in the groups to do some, I call it teaching, but teaching about like imposter syndrome or buffering and some of the typical vicarious trauma. So you can talk about some of those things in a more theoretical way to people people comfortable. And confidence and imposter syndrome is, of course, a huge issue in trainees. And so I think that's really a beautiful.
I think it's still there even amongst, attending, especially women. You see the Facebook page group posts about imposter syndrome and stuff like that all the time. So yeah, it sounds like it's becoming that, because coaching has been around in other industries and for other types of professions, for a very long time. And it's seeming like it's starting to become, executive coaching has been around for a long time too, right? Even among physician executives. But I agree. I think it's starting to not have quite the, like people are like, what's coaching? And people are realizing that it is super helpful because, and we talked about this briefly the last time, the difference between like therapy and counseling or coaching. Coaching is very forward looking, very positive, very sort of, action and goal oriented. So it gives you back that strength or the feeling of empowerment that you can, like you said, you can actually change the circumstances that's keeping you unhappy.
100%.
Proactive.
What's interesting is that often physicians feel like they have to be an extremist to get a coach. And what I would advocate is so many other people in the world in professions like ours, they all have a coach. And I liken it to, it's like a trainer for your mind. So all athletes have trainers, right? And actually, as physicians, we're like, it would be fine to have a health coach or a running coach, but I don't necessarily want that for my mind. And yet our roles are even harder than that of a professional athlete, right? You're taking care of things that are life or death, and you're involved in all kinds of things. We train for longer. Our, OR days, I'm not a surgeon, but OR days are longer than, a football game or a baseball game or anything like that. And yet it's seen as like a shortfall if you need a coach. And I do think, absolutely so many people are struggling that you should also get a coach if you're struggling. But some of the best coaching happens for me on days where people say like, oh, I felt like maybe I didn't even need it today. And that's when the true breakthrough comes, because they're much more open, really making the progress and the transformation, as I like to say. So I would encourage people that, if you're even a little bit stuck or a little bit dissatisfied, or I like to think of it as like preventive care for your mind. Because if you so all coaches keep working with coaches, because we're, that your mind just starts to go into these spins. That's what a human brain does. And for highly trained, very smart human brains, which physicians have, it's even worse. It's even worse. And so, we've invested so much in becoming doctors, time, energy, money, given up so much that like, this is a tiny investment in your well-being that can just change your whole experience of life. And for many, they decide that they want to stay doing exactly what they're doing, but they're just going to enjoy it. And it allows them to do all these other things. And so you don't necessarily, need to be thinking, I have to get out of here. You might start coaching that way, but many people think that whatever they're doing is just fine afterwards. Right. Or really know where they want to go. Sometimes people know they don't want to do this, but they have no idea what they want to do.
Right.
Just frustrated.
Yeah. Well, one of the things that seems to come up is that whole thing around, paying for a coach, right? Like that, I'm sure you hear that a lot. I'm sure, Jessie, you never hear that. So when somebody says, boy, it sounds really wonderful and it sounds like it would really help, but I have all these student loans and I literally can't afford it. And, da-di-da-di-da. What's kind of I just want to hear, I was curious. What's the kind of response?
It's funny, we all tell ourselves stories about what we can afford. And I think back about myself. So I will tell the story that I didn't want to pay for a coach. I thought it was too expensive for a long time. And it was the best money I ever spent. So I tell people that story because I'm someone who often looks at things and I'm like, I want to do that, but it's too expensive. So I'm not. And now what I realize, for me at least, and this is not to convince anyone to do it, coaching has saved me a ton of money because I no longer buffer with all the things to make myself feel better. I don't need to buy all the shoes and go out to all the dinners and go out, travel everywhere. I'm much more intentional in what I do and what I choose. So I've saved the money moreover, although probably not, because then I became a coach, so I probably spent it on that. But so it's probably a wash, but I'm happier, so it's good. But I think we often tell ourselves stories about it. And I just think we're also, as physicians, we're not used to investing in ourselves.
Right.
We're going to invest in education. This is a form of education. What's really interesting to me is a lot of people only want to do it if they can get it reimbursed, right? It's like, can I get insurance to pay for that? Or I will offer that many institutions actually will help pay for coaching if you ask. Professional coaching is known to decrease burnout, and it's known to improve performance. And so like, if you're hearing that message, like, just ask, because there are quite a few places that'll be like, oh, well, we either have a stipend, or some places you can use your education fund, because there is evidence-based research. There's a few, not very many, but a couple of studies that talk about different coaching programs that led to decrease in burnout on the Maslow burnout scale. So, but to me, it's just that we don't think of ourselves as worth it. And you have to decide that you're worth it. And you have to decide, part of actually investing in it is like, when I paid the money, I was like, all right, I'm going to figure this out, because I paid that money. And on the one hand, you don't want to think about it that way. And on the other hand, if it's motivation, it's kind of like paying for a gym, right? It wasn't just that. Like, I had to show up for my coach, and I couldn't like not do the work. And so there was actually that piece of it too. I think that you can do, I hear a lot like self-coaching versus having a coach, and group coaching versus one-on-one coaching. And
I was going to ask you about that. Yeah.
Coaching is better than no coaching. This is my thought about it. And I actually have pretty clear thoughts about it, because I've tried it all, because I want the cheaper stuff to be better, right? So it depends a bit on you. The self-coaching is just that. It's self-coaching. So there's no accountability. And you can be a consumer in self-coaching. So you listening to the podcast is being a consumer. And even doing stuff on your own is much more consumptive. Whereas when you work one-on-one with a coach, you have to do the work. And so if you really want to change, I actually think that it's in many ways ultimately cheaper if you do the work one-on-one and have someone. I think there's an amount of the one-on-one work where you dig into it and you really learn about you, and you really understand how it works, and you understand how your mind works. And then the group coaching is kind of a great way to keep on track and to just check in.
Right.
The thing about group coaching is you have to be willing to be vulnerable in front of a lot of people. Right?
Right.
I mean, it might only be 5 people, but even there, we're not all comfortable being vulnerable. There's tremendous gain in doing it. So my current mind says that doing some amount of one-on-ones first, or doing a hybrid where you do some one-on-ones and some group coaching, you can absolutely learn from other people. And you can learn from self-coaching. Like, if you can't do anything, do that. But I think that having someone be your coach, and having someone, paying attention to you and what you're doing is really important.
Yeah.
I think then you can try all the other things. And you also want to understand you and what works for you. So for some self-coaching will work. You don't do it for the money piece of it. Do it because you know that that's something that works for you. Or you want to explore it and you want to just learn a little more and see if it resonates before you work with a coach. But I have a lot of people say, I'm just going to do the self-coaching stuff, and I think that will be fine. And it's not at all the same. So
the one thing I'll offer up, which is what I kind of, because sometimes like you said, you have to play these mind games with yourself, is none of us probably can go on any vacations this year. So I figured I'm going to take like our family's vacation budget and invest in getting a coach. So that, again, sometimes we just have to play these mind games, and that's just how it is. But just kind of putting it out there for people who might have been considering it, because cost is an issue. I don't want to minimize that. We all have budgets. We have all kinds of financial obligations, but and then we're kind of really not doing much shopping right now either. Haven't gone to the mall in months now.
Well, that's saving you a lot of money.
Yes.
But a big piece of it is valuing yourself.
Yeah.
And so for so many physicians, we think we're not enough. We think we're not worth it. And what I would offer is like learning to value yourself is a huge gift for you and a huge gift for everyone around you. So some people, actually I'll say a lot of people come to coaching because loved ones are losing it with them. And so they're like, I have to do something because, and if that's what it takes, fine. But I would offer, don't let it get to that. Like if you're struggling,
you bring up a good point. Like, I mean, if it gets to which I'll tell you, it was kind of rocky there for me. And now that we're talking about, I know it was a lot of job stress, but, with like my relationship with my, very sweet, patient husband too, right? And I was thinking, what if we had elected to go for like marriage therapy? I'd still have had to pay. And really the work was me. It wasn't so much us. It was, because once I got that and started getting better, it definitely helped our relationship too.
I have a lot of people who have tried therapy and have tried marriage therapy and then come to coaching.
Yeah.
And find that it's changing yourself. And again, it's just a beautiful thing. Like, it's not that you're broken. It's just like, why not make things better? It's kind of like, why not make a better world? Why not make something more beautiful? And you don't have to think of it as like a shortfall or a downfall that you need a coach. It's like, a lot of people use personal trainers at the gym.
Right.
So
it's improving your game. That's what it is. It's improving your game. That's how you look at it, right? And then the other thing, there are a lot of people who offer, complimentary sessions because I think a fit is really important, just like everything else, chemistry, right? So there's no harm in at least exploring it.
Everybody does like a single session to get to know you, because as a coach, you want to work with someone who's a good fit for you.
Correct.
And I don't think that there's a perfect coach. The one thing I would say is a lot of people indulge in this. I'm going to interview 7 coaches and try to figure out. That is not helpful for anybody.
Right.
And what I would say is, do a little research or just talk to a couple people, but don't torture yourself. It's not like there's the best person or the fanciest person is the right person. To me, it's a connection. Like if you feel a connection with that person or most coaches have a lot out there about them that you can kind of know about them. And if you feel that connection, that you should just go with that, because it's a lot of inner work. There isn't like a better coaching program. Well, I mean, there isn't a perfect one, as doctors were always like, oh, well, if Harvard is better than whatever is better than whatever. But for each individual person, that's not true.
Right.
And it is a lot about fit and style. And you want to find someone that resonates with you. And I think you can tell that in an hour, and they can tell it too. And a lot of times it's just a half an hour, but usually at least a half an hour of finding out what you're struggling with and whether coaching is the right answer, right? Because we don't want to bring someone into coaching. We don't, as a coach, nobody wants to take your money, right?
Exactly.
People who are coaches, especially physician coaches, want to help, right? They're doing this. They come from that place of compassion and service.
Right.
So, sometimes I think if you're in a huge group, maybe that's not true because it's just a volume thing. But if you're doing one-on-one coaching, then you really want it to be a fit.
Yeah. Wow. There goes that hour again. But at least I didn't lose you at the end of it like I did the last time.
You didn't just drop off the face of the earth.
Well, thank you again,
You're
Jessie.
welcome.
That was so useful, so helpful, and I hope our audience enjoyed it as well. And maybe we'll have you back again sometime.
And feel free to reach out anytime if people have questions. A lot of people have reached out to me with questions, but I'm happy to answer them and be available. And go do some yoga and do some yoga and get a coach. It will change your life. And
you have a session now coming up, right? In a little bit?
Yeah. I teach yoga at 4:30 on Sundays. If any of you want to join me, you're welcome to. It's through my local studio, so I can just say, like, I love it when people from across the country join because they're like a small local business that's like trying to stay afloat in COVID. So we in California are still pretty much shut down, so it's all still on Zoom. So you can sign up there and you can do yoga at the Mindful Healthcare Collective too. If you are interested in that, that's the Mindful Healthcare Collective.
Wonderful. Thank you. Thank you so much again. That was so awesome.
My pleasure. Nice to chat with you.
Nice chatting with you, Jessie.
All right. Talk to you soon.
All right.
Okay. Bye.
See you. Bye.